Well, hello and welcome to the Smart Mobility Living Lab here in London for this special webinar from TRL, Lessons from Australia, how the UK can learn from the Graduated Driver Licence Programme. We've got three really interesting guests to bring you over the next 80 minutes. We've got Dr. Shaun Helman from TRL, Professor Rebecca Ivers from the University of New South Wales, and road safety campaigner Dr. Ian Greenwood. And we'll start with Dr. Greenwood, who will speak to us for about the next 15 minutes. Dr. Greenwood, if you'd first like to give yourself a bit of background for the audience, and then the floor is yours, sir.
Thank you. Good morning, everybody. My name is Ian Greenwood. I've probably got three hats. Firstly, I used to work in the NHS and used to be a clinician looking after children and adults following trauma and trauma networks. Secondly, I've done some research and I'll talk a little bit about that this morning. And thirdly, probably most importantly, is I'm a victim of road death. My 12-year-old daughter was killed in a crash 16 years ago. Shall I just start?
Yes, please.
So I did just want to say something before I started in terms of that famous quote, which was by my nan, my late nan, rather than Gandhi, but didn't know who he was. But just to say, if you don't ask anything, you don't get anything, do you? So I was talking to Rebecca saying, if you're coming to London, why don't you do something? She said, yes. And I said to Shaun, we need somebody to host. Rebecca, will you do something? And he said, yes. So I just wanted to say thank you, because these guys is why we're here today. So I'm really looking forward to this. I'm really looking forward to hearing Rebecca, particularly, sorry, Shaun. And I'm absolutely sure we can learn from this today. So graduated driving licensing is really controversial, and we have not managed to persuade our politicians that it's worthy of our young people in the UK to have it, even though we know that it saved lives and reduced serious injury. We also know that there's probably opportunities now that we probably never had before. So I'm quite optimistic looking forward. What I wanted to do today was just to set the scene. I think we're probably all here to talk to Rebecca, but we thought it would be helpful to set the scene from a UK concept point of view, and particularly from a why haven't we got one yet perspective. So looking at people who are in the room, I've no idea who's out there in the ether. Some of you might have seen some of this before, but I think it's worth repetition. The other thing is, you never start a presentation like this talking about academic pieces of work, but I'm going to do that. A guy called John Kingdom, so I've used that both in my own work, in my research, but also framed how I'm going to do the presentation. And it's just to give, I hope, my own research credibility. It's based on 34 years worth of critical discourse analysis, based on the things you can see on the slide. It does say 666 in there, which I've kind of hidden, which is slightly worrying. 6 inquiries, 6 policy documents, and 6 debates. But what I wanted to focus on problem, policy and politics. And what I want to try and argue this morning is that politicians have regularly seen that we've had a problem with road safety for young drivers. We've had policies available to us for decades, but the politics hasn't quite worked for us. So that's what I hope to demonstrate. There's quite a lot of quotes on here. I wouldn't encourage you to read the whole quote, because I am going to fly through these fairly rapidly. But what I hope to do is give you a bit of a flavour how long we've had this problem and how long the solutions have been available to us. So I'm sad. I searched 1937 in Hansard. This guy, Labour MP, was the first reference I found who talked about the risks associated with the young driver. 87 years ago, so politicians have been talking about and have known about this problem for a very long time. New Zealand were the first in the world, we probably all know that, in 1987, 37 years ago. And since then, an absolute ton of peer-reviewed evidence has been developed over the decades from different countries across the globe, which has pretty much proven that graduated driving licenses is effective, and there's very little doubt from a public health point of view, but also from a transport safety point of view as well. Now, I love this quote, and I'm sorry, I'll probably keep using it, but Lady Olga Maitland, probably just for her name, was a Conservative MP 31 years ago, again, talked about the risk to young drivers. I probably wouldn't use her language. She says if we clip their wings, i.e. young people, we shall do a great service, because fatalities in the 16 to 19-year-old age group is disproportionate to all other age groups. So again, 31 years politicians have talked about this and have known this. Some of her language is a bit interesting, which I can read the quote later on if you get the slides. Again, fast forward 29 years, Steve Norris, who was one of the transport ministers in the Tory government, you will know the 6-point penalty that came in at that point. That was an interesting debate. The reason for mentioning that is for the fact that we've got that part of a form of graduated driving licensing in the UK. But importantly, at that stage in the political cycles, there was consensus in the House of Commons, and political consensus has been a flavour throughout this whole period. When that has happened, we've had data delivered. For those that have met Gwyneth Dinwoodie, you know that she's a lady that you never ever messed with. I never actually had the pleasure of meeting her, but 25 years ago, the first dedicated young and newly qualified drivers transport committee report reported. Again, same sort of theme. I hope you're hearing a theme here. The same sort of things have been found time and time again in different parliamentary processes. The main reasons why young and newly qualified drivers have such a poor safety record is their relative inexperience and their immature attitude. Hardly news to those that are familiar in this territory, so why on earth did different politicians not respond, different governments not respond? You can almost hear the irritation a few years later, same transport committee, same report, different document, one on novice drivers. She was really, apparently she didn't get on with Tony Blair anyway, but she was really, really irritated that the Labour government didn't do anything. And again, you can see here, she talked about the gap between the two reports that she published. And there's been little progress, she says, in tackling the problem of road deaths and injuries of young drivers and those impacted by young driver crashes. This report, again, people will be familiar with it, not least just because of the title, Ending the Scandal of Complacency of Road Death in the UK. It wasn't specifically about young drivers, but it did have a big chunk in there about young driver risk. And again, Louise Helman was talking about learning to drive, so testing and learning, and the optimism bias that politicians have looked at certain interventions optimistically with the hope that it will drive change, and ignoring those like graduated driving licensing that has evidence behind it, but they've chosen not to implement it. So she talks about the proposals, i.e. testing and learning, place a great deal of faith in improved training, overcoming what some witnesses see as genetically programmed caveman tendencies in young men particularly. And again, I wouldn't choose to use that language, but again, it's very, very clear, I think. Fast forward a few years, a Conservative backbench MP, Stephen Phillips, who was advocating for the Challenge family. So this is 10 years ago. And if you're geeky like me, this is probably one of the best features or one of the best debates that I've read in 34 years of reading this stuff. And he basically asked the question, this was the period when the government promised a green paper, they promised it and ditched it. So he was challenging that. So he says, neither the government nor their predecessors have taken the action necessary to ensure the safety of young drivers on our roads. And he asks, why is that the case? He doesn't answer it, but he does give Robert Goodwill, who was the minister at the stage, dare I say in public, Goodwill by name. And what he says, Stephen Phillips, is that frankly, either he needs to reverse or face the consequence of not doing the green paper. Not doing so, what will mean for the death and serious injury to young drivers in the future. I would add young drivers and those impacted by young driver crashes, but we know what's happened since this date, 2014 to today. So I found this other one. I thought I'd have a bit of research to see what Ian Greenwood had to say. And this hasn't been in previous presentations. So there was the final Transport Committee inquiry on young and novice drivers, and Ian Greenwood used to be a member of the Transport Committee, and in the middle of that inquiry, she asked a question in the House of Commons of the Minister. You can see what she says. She recognising the evidence that restrictions, i.e. graduated driving licensing, on new novice drivers post-deaths has proved very effective at improving the safety of young drivers, to which the Secretary of State, Grant Shapps, said that there were other things that were much better. Sadly, he didn't tell us what the other things were, nor did he do any work to demonstrate that there were alternatives, although the government did commission a very significant piece of research, Driver 2020, slightly earlier than this. So I mentioned the Young Driver Transport Committee inquiry. Hugh Merriman was the Transport Committee, and very clearly it set out that the government were not interested. So in contrast to all the previous examples that I've shared, this is the first time graduated driving licensing was not recommended. It was recommended in all the previous Transport Committee inquiries. This was not recommended at this stage. Hugh Merriman relied very heavily, the committee report, we've relied very heavily on what they call a lack of a mandate. Sadly, their mandate was taken by 14 young drivers who they all asked, you don't want to stop having restrictions to your driving, do you? To which they all went no. So those academics listening in this morning will be horrified by that, but the government did, or sorry, the Transport Committee did advocate that as a main reason. Reports, for example, like from the RSE Foundation, who had a large sample group of thousands, I think that's something like 1,500 people, was not mentioned. And what was also very clear was Baroness Veer, who was then the Transport Minister, was very, very clear that she wasn't interested in picking on young people, and she wasn't interested on age-specific interventions, which, if you from a public health perspective, that's an interesting policy approach. And I have no idea what time it is because I can't see a clock. Am I right? Fine. So fast forward to this year, there was a petition that many will be familiar with earlier in the year. It probably wasn't the best worded petition, but nevertheless, there was a petition to have a graduated driving licensing system in Britain. This was the government's response to that petition. The number of fatalities on Britain's roads is falling. It's been a very regular mantra from different governments over decades that the numbers are falling, therefore we don't need graduated driving licensing. So you end up in a debate about what is the right sort of number at which you then don't do policy intervention. Now, that is factually accurate, but the way that they have shared their data is they always start seemingly with young drivers. They always seem to start from 1990, which seems like a very long period of time on which to then do statistical analysis. But it also masks changes within that data period. So, for example, yes, very latterly, and yes, we had COVID, but there's been an increase in the number of young driver deaths. The other thing about data, which is quite interesting, I think, is that often government will report on those killed and seriously injured in terms of how they present their data. With young drivers, they tend only to focus on the driver themselves. And I think that's really problematic because there is, I think, a discourse that goes something like, well, it's just young lads, isn't it? We can't control what they do, ... therefore we can't do very much about that. What that narrative and that discourse masks, in 2022, there were 4,935 deaths and serious injuries of people driving, young drivers driving, their passengers, but importantly, 50% of that number are people just going about their day-to-day business, on a zebra crossing, waiting by the side of a road for a vehicle, etc. So the way data is presented, I think, is really quite important. And the way we use language, I think, is quite important as well. I haven't really majored on that, so I was talking about the politics, but maybe the language of this may be part of what we talk about this morning, listening to what Rebecca has to share. So, Paul, I can go really quick or slow now, depending on the clock.
You have as much time as you wish.
So what I wanted to do now was to move away from the kind of the political analysis, if you like, and kind of try and connect what we've done to date within Britain, and then lead into what Rebecca can share about Australia. So my sense, and it'd be interesting to see what other people think, is 2024 has seen a significant shift in how we've talked about this, in the visibility of talking about the risks to young drivers and the risks to others who are impacted by young drivers. I've put some examples on here. So there's obviously today, one of the things I was really particularly pleased about, a number of academics, there were 25 in total, who published a supportive letter in The Guardian earlier in the year, which I penned. Sadly, not all names were published because they don't have enough room, apparently. But that was really important for me because it took the discourse into a different place. It took the discourse away from those poor victims or those young lads who got running about it narrative to a whole series of very serious and well-respected academics who said, listen, government, we've got a problem here, and here's a ton of evidence over many decades where you should be seriously considering graduated driving licensing. It's in The Guardian. You can see the title on the slide. It's a short letter if you want to go and find it. And there's been lots of other things. So the Young Driver Focus, the manifesto that was published by PACS earlier in the year that has graduated driving licensing, calling from about 100 organisations calling for 4 different interventions, one of which is GDL. Joe Shiner, who is the Chief Constable of Sussex, but also very supportive of the efforts to support young drivers much more effectively was at the break annual reception that Archie and I spoke at, and again was very, very supportive. So we are gathering more momentum. I think it was seriously affected by the general election, but again, maybe that's something we can talk to. And the other thing I wanted to mention was that connection between health, public health, and the intersection between that and transport safety, which I think is really important. I'm really interested in what we learned this morning, but I think one of the big weaknesses in the UK is our colleagues in the health system are silent or not very loud. And we can possibly explore that this morning. And the last thing I wanted to think of, just very quickly before I finish, is partly to go back to my problem policy politics thing, which I'll just say a little bit more about. But this is just a sample of a lot of the interventions that have happened this year. People will recognise Kim Leadbeater MP, who's the lady in the middle of the screen, who did the 10-minute motion approach in Parliament earlier in the year. Seriously affected by the fact there was a general election, so that didn't happen. But also, we have a support group, campaigning group called Forgetting Not Families Uniting. So on the right-hand side, just by the word and policy and the tick, is a meeting that happened between two members of that group and Louise Hay, who was then Shadow Transport Secretary, who is now the Transport Secretary. We can't find anything very quotable, sadly, but in private, she was very, very supportive. So I guess what I would finish by saying is my sense is that there's a gathering momentum of change. Let's learn from what happened in Australia and carry that on. I do believe that politicians recognise we have a policy problem, and I do believe from what they said prior to the election, they were prepared to do something about it. So a policy problem isn't just another policy issue, it's something that politicians are prepared to do something about. We know the policy, we know that testing and learning, there's a huge optimism bias that it will make a huge difference. Others may talk about that in a more better informed position than myself, but it's all about politics. So I think what I would encourage people to do is to focus on the politics of this and then taking this forward. And that's me done. Thank you very much.
Thank you very much indeed, Ian. That was fascinating. A couple of points that jumped out. First of all, Ian Greenwood is now, of course, kind of, I suppose, poacher turned gamekeeper by the fact that she's now Future of Roads Minister. So you've got somebody who's been an advocate in the past, now at the heart of policy in the DfT. So we'll come back to that a bit later. And the other one I just wanted to suggest that we pick up on a bit later as well is that a lot of the road deaths, I think back to the fact that I passed my driving test in 1988. So I'm at the beginning of those statistics that you're talking about. The car I drove in 1990 would have been far less safe than cars now. And I think the brilliance of doctors in saving lives that 30, 35 years ago, people would have died in crashes. Again, that's not taken into account, I don't think, when you're comparing. So you're not comparing apples with apples from 1990, but we'll come back to that. You've talked about the fact that it's lessons from Australia. So let's get those lessons from Australia with Professor Rebecca Ivers of the University of New South Wales. So thank you very much for coming over from Sydney to the beautiful late English summer that we're enjoying here in London today, Professor. Tell us all about your experiences of a graduated driving licence in Australia.
So thanks very much, and it's fantastic to be here with my colleagues, Shaun and Ian, who I've been engaging with for many years. So my name's Rebecca Ivers. I'm Professor of Public Health. I'm at University of New South Wales, and I've been working in road safety for 20 years. I'm public health background, but I've been doing road safety research for many years. So in 2002, I established the DRIVE study, which has tracked 20,000 young drivers in New South Wales for many years and published a lot of research about young drivers. So very familiar. And I've also worked with Aboriginal communities in Australia to co-design, implement and evaluate driver licensing support programs for Indigenous and other marginalised people to help them get their driver's licence alongside the graduated driver licensing. So I've got decades of road safety research experience, and I've worked in young drivers, motorcycle safety, heavy vehicle, child injury, and I've worked very closely with government and advocates because, of course, research is only one part of the puzzle, and I think that's clear. I think you've just highlighted that. I think in your talk, research is only one bit. We actually need to know how to work with the media, with politicians, with the public to get things into practice and change policy and improve lives. I am also the mother of two. I also have a stepdaughter. My stepdaughter didn't get her license till she was 30 because she lived in major urban areas. She didn't need a license, but my two younger kids both got their driver license under New South Wales graduated driver licensing scheme, where we had to supervise each of them for 120 hours of supervised driving practice. I can tell you, wasn't that bad. That's a picture of my husband and my son there underway. I think I think, people start sort of talking about how terrible it is. I have to say, for me, it was a great opportunity to actually spend a lot of time with my children at the age of 16 and 17 who normally don't talk to you. So it does actually provide a bonding exercise. So adolescence. And when we talk about graduated driver licensing, we really are talking about young drivers. We are talking, novice drivers are really important, but really the biggest impact is actually on those younger drivers. And I think we need to remember that adolescence is a time of increased risk-taking and novelty seeking. And people, when they're getting their driver's license, they are still firmly in the middle of adolescence. Adolescence, we now actually say, goes up to the age of 24 years, which is when your brain is fully developed, where you are fully able to actually judge risk, where your risk perception becomes close to that of an adult. It's also a time where you're trying to become independent, you're making social affiliations, you're trying to actually impress your peers, you're trying to create your sense of self. You also have variable decision-making skills. But then we are actually putting adolescents behind the wheel of a car, which is really something, as we know, that's quite dangerous. And we do then see increased injury in the adolescent years. And the burden's greatest for suicide and self-harm, road injury, but also poisoning, sports and work-related injury. So it's important to keep that in mind when we start talking about graduated driver licensing. Now, I'm going to go back to the early 2000s, which is, we had a graduated driver licensing scheme, but we really did need to up the ante a little bit. Young drivers were still very much overrepresented in car crashes. We had a basic graduated driver licensing scheme, and I'll give you a bit more detail about that. Drivers had to do 50 hours of supervised driving experience, but we were still seeing increased risk of crash. And so there was a real need to actually really strengthen the scheme. What we did, and you'll see from this article, this is from the Sunday Telegraph, and you can see on the right-hand side, the Sunday Telegraph's campaign to save the lives of young people. We worked really closely with the media on this. So what was really important, that the media were firmly behind changes to and strengthening of graduated driver licensing. We'd had a series of multi-passenger crashes, and everyone in the community was reeling. Young drivers were overrepresented compared to the rest of the community, still at 2 to 3 times the rate, and particularly for young men. And there was a real need for us to actually strengthen the program. So what happened? And at that time, and I think it's really important, it's coming back to what you've said, who was engaged in this? We have the research evidence. So we had all the scientists, all the academics there saying, well, this is what we need to do. It's been shown to be really successful in New South Wales and Canada and the US. But we really did need to actually get the community on board with this. And to do that, it took quite a few years, and certainly the UK has been, advocates have been working on this for quite a long time. There were parliamentary inquiries, and remembering Australia is a federation, so this has to be done at the state level. So it's got to be done in numerous locations for all the states and territories. And I'm talking about New South Wales here. Parliamentary inquiries. We had ministerial road safety advisory councils. We had cross-government support. We had the media campaign by the Sunday Telegraph. We had the College of Surgeons, the Trauma Committee, who were really influential. So all those frontline emergency clinicians were out there saying, we are sick and tired of seeing multi-passenger crashes. We're sick and tired of trying to actually save the lives of these poor young people who have come in here in these traumatic crashes. But we also had parent advocates. And this is Rob Wells here, this picture here, who was a really powerful advocate. His son, Bryce, was killed in a multi-passenger crash up in the Northern Rivers during this period. And he was an incredibly powerful advocate. He came in there, he sat on the parliamentary committees, he lobbied, he worked with the media, and he put his pain aside, or despite his pain, he spoke out because he wanted to make a difference. And Rob still continues to be engaged in advocacy to this day. And we still have other very strong advocates in Australia as well, like Peter Fraser, who some of you who will be familiar with. So that was actually key. It was a bit of a coalition of people saying this, enough is enough. The data is showing, huge issues. We've got a solution. Let's try and get that through. Now, we've got to remember that road safety is always political. Everyone's got an opinion about road safety because we're all road users, every one of us. Whether we drive or not, we use the roads, we're pedestrians, we're cyclists. We all think we know what's right. In the same way that we all think, most people think that they're better drivers than everyone else, everyone's got an opinion about road safety, and people have strong opinions. In Australia, we always have this issue about revenue raising, which is that whenever we try and change legislation or put in place more restrictions and fines, everyone says, oh, you're just trying to raise money. That's all it is. It's just revenue raising. So this is a history of GLS in Australia. In the mid-1960s, basic forms of GLS were introduced in Australian jurisdictions, though in the early 2000s, no jurisdiction had a comprehensive GLS in place. 2005 to 2008, we had a revised graduated driver licensing scheme that was introduced in New South Wales, and we had significant additions between 2005 and 2008. So we just kept introducing new measures into the GLS to really try and tighten things up. Now, the GLS is actually matched to the period of risk. So you can see during the learner period, the risk of crash is very low. You've got a supervised driver in the car, and you know that that means you've got two pairs of eyes out there, and you certainly got the parent or the driving instructor in the car sort of, they're cautioning. So, and I think that's really important to remember. So this is generally that low period of risk is when parents are supervising young people. These kids aren't all in cars with professional driving instructors. They are generally in the car with mum and dad, and you can see how low the crash risk is. Then the P1, so red Ps, are introduced in that very first, very dangerous period when young drivers first get their licence, and that you can see, the dramatically increased risk of crash when people go out there as solo drivers. And then you can see the green Ps, so when we lift some of the restrictions for the next 2 years as we get closer to the crash risk for the rest of the community. And you can see that it drops off over time. So what are the key elements of the GLS? So licensing at an older age for increased safety. So you can get your driver's license, your learner license at 16, but you can't get your first provisional driving license until 17. So in Victoria, it's actually 18. You need to have extensive supervised driving experience in various conditions before driving solo. In New South Wales, it's 120 hours with a minimum of 20 hours driving at night. And I have to say, as I said, generally with a parent or another fully licensed driver. Many people use driving instructors, and they do have, most people do get lessons with driving instructors, but I mean, there's very few people that can afford to have professional driving instructor provide 120 hours of supervised driving practice. So generally it's the parent. Effective testing to ensure only safe drivers are licensed. We've done some research through the Drive study that's actually shown just how effective both the on-road driving test and the hazard perception test is. It's very effective at actually screening out drivers. So we know that it's effective. And then the risk reduction measures to limit dangers from alcohol, distraction, late night driving and multiple passengers. So restrictions in that, particularly in that first year. We also have behaviour control measures with stricter penalties for high risk behaviours like speeding. So if you're on your red Ps and you get caught speeding, immediate suspension, you lose your license for 3 months. And that's a powerful motivator because, if you've gone through 120 hours of supervised driving practice, you do not want to lose your license for 3 months. Then we have, as I said earlier, licensing support to ensure safe access for all community members, knowing that there are people from marginalised communities, low income, kids in out-of-home care who do not have access, who don't live with mum and dad, who've got a full driver's license and don't have access to a registered vehicle. So we do need to have schemes in place to support those people to get their driver's license. So our GLS policy framework, and I've pinched this from Bernard Carlin from Transport for New South Wales at the Centre for Road Safety. There's a standard GLS, so learner permit at 16, solo licensing from 17, and this is the original one, 50-hour supervised driving logbook, 0 blood alcohol, no handheld mobiles through the entire provisional period, and lower demerit point for novice drivers and educational programs. Our exemplar are all of the standard measures, but the 100 to 120 hours, restrictions on passengers, late night driving, no mobile phone use at all while driving, so no texting. You can't use your mobile phone for GPS, just a blanket ban on mobile phone use at all. And then a very low demerit point threshold and educational programs. And each of the states has got slightly different variations of this. We still don't have a full passenger restriction in that first year. In New South Wales, we have a night passenger restriction. So And this is the example. So this is the New South Wales scheme. And I think I've just talked about all of that. So your full licence you can't get till you're at a minimum 20 years or older and you've held your P1 licence for 12 months and your P2 licence for 2 years. What I should say though, and I think just remembering that I got my licence at the age of 17 without going through all of this. And I do think it's a miracle that I'm alive, judging by the way that I used to drive and the cars that we used to drive. My kids also were able to get their driver's licence at 17. So their driving experience is the same as mine. They were still able to drive as a solo driver at 17, get to work and education. It's just the way in which they got their licence was different and the conditions under which they drove, particularly in that first year, were different. So really, we're not restricting young people's independence. We're just saying, let's put in place a system that's going to keep you safe. We don't want to see young people losing their life. And we know how devastating crashes are. We know how devastating fatalities are for a community. It's not just the person and their family. It is devastating for the whole community. And this is what I think we need to be really mindful that this is what this is all about. So again, the restrictions, speed, P1 drivers can only drive at 90 k's an hour or less, P2 100, 0 blood alcohol for both, no high performance vehicles. So there's a list of high performance vehicles and the police will enforce that. Mobile phones, as I said, and a peer passenger condition in P1, if you're under 25, no more than one peer passenger between 11 p.m. and 5 a.m. And then there's restrictions, as I said, about speeding. So, and I think, that's pretty standard. So the driver licensing support programs and driving change was one of the programs that we set up, focused on low income, Indigenous and migrant populations. It's supported by government, but also NGOs and charities, and that provides end-to-end licensing support, assistance with ID documents and driving tests, access to supervised driving practice and driving instruction. And variations of these kind of programs are present in most states and territories in Australia, not just, and in Victoria, for example, they're pretty widespread. So they're the other kind of programs that support it. We also have some other options. So for education in New South Wales, the Safer Driving course gives you 20 hours off your 120 hours if you do that. That's a day-long course. For new drivers under 25, you have to have completed 50 logbook hours already, and we have about a 35% uptake of that in New South Wales. And then we also have a 3-for-1 deal for professional driving instructors. So if you do, you get hours off if you do professional driving lessons as well. So you can come back if you do both safer drivers and 10 hours of professional lessons. You only need to do 80 hours of supervised driving practice. And the supervised driving practice is recorded via an app. You get an app on your phone, and after for each hour you sign it, your parent or supervising driver signs it. So it's pretty easy to do. In the old days, we used to have a book and you'd have to sign off on that, but we have now an app, which is pretty effective. Okay. So let's have a look at the effectiveness. So we have seen that across the 15 to 24 year age group, fatalities have reduced by 29% over the last 10 years. All Australian jurisdictions have had reductions. And in New South Wales, we've seen a 50% reduction in the number of young drivers killed on New South Wales roads. Now, I think what's really important, I think coming back to your point, Ian, that you made before, is that what's really important, though, is that we also look at the overrepresentation of young drivers, because we know the fatality rate in every jurisdiction has been coming down. We've got safer roads, we've got safer vehicles, we've got safer systems. What we want to see, though, is that not so much, we know young driver deaths are coming down in the UK without graduated driver licensing. What hasn't changed, though, is the overrepresentation of young drivers, and that's the key. That's the key point. So this is really nice, because what this shows is the driver involvement in casualty crashes in New South Wales since GDL was increased. So you can see the first period is before this new enhanced one was introduced, and that's the bigger hill. The lower one is since then. And you can see that we've dramatically reduced those crashes and involvement in serious crashes, but you can also see that peak has reduced. So the relative increase of those deaths in that first period at the beginning of the red Ps, the P1 has dropped quite dramatically. So we've really flattened the curve here. And we have seen a bit of a change in that overrepresentation of young drivers, but I think that reduction in that peak is really important. Interestingly, you can also see a reduction in the learner period as well. not as dramatic. So there's been some good evaluations recently. Teresa Senseric, you can see the reference there, evaluated the Queensland GLS, and they have shown significant reductions. They did show over a third of crashes. I mean, again, I think it's really important. Over a third of novice driver crashes resulted in at least one death or serious injury. This is a big problem. This is a common problem. It's something that impacts the whole community. What they showed was a 14% decline in all crashes, 30% in night, 22 for passenger crashes in the first month of the new GLS compared to the old GLS in Queensland. This paper's just been published, and I'd encourage you all to have a look at it. It was published in August, and this is a health economics evaluation of the New South Wales night peer passenger restriction. So what this shows, and this is specifically just looking at night crashes, and you can see that when the new restriction was introduced, there was a dramatic change. So around a 50% reduction in all crashes, including fatality crashes. You can see particularly at night, but also the crashes during the day. So it's not just impacting the nighttime period, which is when it is implemented. It's also impacting day, and that's because it's sending a message to parents that carrying peer passengers when you're a novice driver are dangerous. It's giving parents a license then to go and say, well, actually, we're getting all this information now that carrying passengers when you're driving is dangerous, so I'm going to restrict what you do in the daytime as well. And we know that it's dangerous. We know that for every increased peer passenger for young men, pretty much doubles the risk of fatal crash. So it's almost like an exponential relationship. So, and it's particularly an issue for young men, and we see that you can see that in the crash data. So what this showed that the night multi-passenger crashes before this was introduced was 18% of first-year driver fatalities, only 4% afterwards. This is pretty powerful stuff. And overall, it reduced these crashes by 50%, multi-passenger crashes, casualties by 50%, hospitalisations by 58%. We don't ever see these kind of interventions in public health interventions anywhere. This is pretty extraordinary. And it also reduced multi-passenger crashes earlier in the evening and in the second or third year of driving, even when it wasn't in place, again, extending the policy impact. And the authors have said it's similar to estimates of the impact of raising the US minimum driving age for 1 year. What's really important though, it's not restricting young drivers' access. It's specific policy that targets those high-risk period, and it's really effective. It doesn't delay young drivers from gaining experience behind the wheel. And actually what you can do is if you've got a supervising driver in the car during this period, you can still get that driver to carry peer passengers, but you need mum and dad in the car. So they can still get that experience at night, even in their P1. And, I know mum and dad might not be, may have a bit of a sedating effect, but they can still get that driving experience. So parental experience, parental support. And I think this is really important for this debate in the UK. There's lots of evaluations in overseas that have shown that 90% of parents who have teens support the concept of a GLS and endorse its specific features. And as I said, parents help enforce GLS conditions. So when police go, everyone says, well, oh my God, do the police really need something else to enforce? Police do enforce this, and the use of P plates on the car, visible P plates really helps that. But parents really help enforce GLS conditions. And in fact, I'd argue that they do most of the enforcement on this, because you say, no, pal, you can't do that. You can't drive at night. I know certainly for me, that was the case. You don't want, you have to say, well, no, you can't carry passengers. You then make arrangements about how to get home. And it gives parents, it really talks to parents. It teaches parents again, and certainly the education programs around GLS reminds parents that young people still need support, and they still need parenting. And that parenting means no, it is actually dangerous. This is a high-risk time for you. Let's work with you to actually work out how we can manage this. So no, you can't have the car because you're not going to be home by 11. No, I don't want you carrying it. It allows you to say to your teenager, well, actually, no, you're not going out with those boys. You can't carry those 3 passengers because I know that's dangerous. You can go by yourself, text me when you get there and when you get back, but no, you're not. But it allows those parents, it gives them the freedom to actually start having those conversations. Whereas in the past, certainly when I got my license, as I'm sure for many of us older people in the audience, I got my license at 17, got the keys to mum and dad's car, and off I went. So, I mean, I think, you know, with no one really, you know, no restrictions on what I did or where I went. Now we can say, well, no, you can't go on a road trip with 5 of your best mates. No, you're not going to be going out driving all night in the car because A, you're not allowed to, but also the parents then get the message that it's not safe through all the information that they get. So I think that's really, really important. And I have to say, in Australia, I mean, there's always going to be a few people complaining and say, oh, you know, we're embarking on this journey. It is well accepted. It is not problematic. And I think it's changed the culture. And I think that's part of legislation. And we've seen that with a whole lot of legislative reform around road safety and other areas. Once you've got it in place, it does change culture. You might have a few hiccups when you first implement it, but over time people get used to it and then it changes culture and people do things differently. And I think that's how legislation should work. So let's just, as I finish up, I just want to give you some other examples of great pieces of Australian legislative reform that have done exactly that. In 1996, there was a mass shooting at Port Arthur in Tasmania where 35 people were killed and many others were injured. And as a result, Australian government, you know, all states and territories got together and said, this is enough. We do not want this to happen in Australia. So John Howard there, and there was this very famous rally where John Howard, the then Prime Minister, spoke in front of the gun lobbyists, and he's actually got a bulletproof vest on at that seminar because he was very worried about his safety, but he put it in place. He was a Conservative Prime Minister, normally one to say, policies all around the nanny state. He put it in place. We had a national gun buyback with 1 million guns bought back. There you'll see Walter Mikak and his 2 beautiful daughters, Alana and Madeline, who were both killed. His wife and his lovely 2 beautiful daughters were killed. He worked with the government. He's still working with the, Alana and Madeline Foundation in Australia. And again, this is a classic case of, a turning point, a horrendous event, but government stepping in, working with advocates and researchers to actually and the community to put this in place. Since then, we've only had 3 massacres with guns, very, very small, and firearms are not, are very much not an issue in Australia in the way that we see, say, in the US. So, and I think that's really important because culture changed. We also see that with drink driving legislation. So again, when we brought in random breath testing in Australia, the alcohol lobby was very powerful at that time. And the Australian Hotels Association was saying, no, this is the end of Australian culture as we know it. It is our right to go down at the pub and have a few beers and go home. And, the commercial determinants of health, it was a really strong and remains a very strong and powerful lobby group. But the government stood firm. We put the legislation in place. Again, people came kicking and screaming. But over time, culture changed. People went from saying, okay, well, you put it in place, behaviour changes, and then perception changes. And people now, drink driving is very much criminalised and looked down on in Australia, and our drink driving deaths have actually completely shifted. It's still a problem, but that was a really great example where legislation was brought in. Seatbelt legislation. In the early 1960s, only 5% of cars had seatbelt fitted. In 1970, Victorian state government was the first in the Western world to introduce compulsory seatbelt legislation. Completely turned around. Seatbelt use quickly rose to 90% with significant decrease in fatality. So again, a classic case of trauma committees, surgeons and emergency people, clinicians working together, advocates and Parliament actually coming together to say, no, this is really important. We're going to do that. It is possible, and we've done that in many, many different scenarios. So as I finish up, Australia is a large country. Driving does remain the main means of transport. Many of the crashes, we have many crashes in urban areas which have been impacted by graduated driver licensing legislation. Our serious crashes in the outer suburban, regional and remote areas also have been dramatically impacted by this. It's very well accepted. And I just want to point out, even Victoria, where the minimum age of independent licensing is 18 years, young people still manage to get to work and education. And the way that we live hasn't collapsed. Life still goes on. So it is possible. And fatalities in all jurisdictions for young drivers have dropped relative to other drivers. So it's been tremendously acceptable and successful. And I do think we do need to consider what the role of government is. The role of government is to set policy, to have impact. But again, I think coming back to what you said about not putting in place policy because 14 young drivers said that they didn't want it, we don't set policy like that. You know, you set policy for the good of the community and to have impact. And what we don't want to see, we want to put an end in the UK to, you know, the multiple young people who lose their lives or are seriously injured. We want them to live their lives in full. We don't want young people living with serious disability for the rest of their lives because governments were fearful of actually putting in something in place that was going to make a difference and save lives. Thank you.
Thank you very much indeed, Professor Ivers. That's fantastic. I mean, I'm going to just make one comment, first of all, as a dad of 3, that I don't think teenagers realise quite the gut-wrenching feeling parents have watching them drive away for the first time, and how every time they drive away, you worry until they come home. And that I don't think happens, and they won't feel that until they go through it themselves. So having the power of being able to say, no, you can't do this, doing it because there's legislation, would give me so much more feeling that, you know, I can step in and save them from themselves possibly. And so I think that is a fantastic comment you made. The other question I just want to ask on Lessons from Australia is, you are, you know, I've been to Australia several times, and the difference between the city and what the city's like, and then you go out into rural areas, what's the difference in effectiveness between the two? Is there any?
Look, I mean, yes, because most of our fatal crashes do happen in rural and remote areas once you get out of the cities, but they also happen on the outer side. I mean, it's a bit hard because of the way in which the data is coded, but, you know, outer suburban areas, once you get onto those windy roads, and they're, you know, quite frankly, they're not that dissimilar to the UK system. Like, we've got fast highways, we've got windy rural and remote roads that are not really all that well developed. So I know I've certainly driven a lot in the UK, and I think those windy rural roads are not that different from Australian roads either, not really that high quality. You know, they might not have wide shoulders and people travel at speed. So yeah, but the GDL has worked very well in those settings as well as in urban areas. But of course, 70% of our fatalities are in rural and remote areas. So it's obviously very effective there as well. Yeah.
We'll come back to you in a moment. Thank you very much indeed. Just a reminder, if you're watching in the office or at home or wherever on Zoom, you can give your questions in the Q&A section there. So please pop your questions in. I've seen a couple coming in at the moment, and we'll come to those in a moment. So we've also got an audience here at the Smart Mobility Living Lab here in Woolwich in London, and we'll be taking questions from them as well. But let's find out. SMLL is led by TRL. So let's find out TRL's thoughts on this with Dr. Shaun Helman. Shaun, thank you for joining us. First of all, just give a bit of background about yourself, and then we will then hear what you have to say.
Fantastic, thank you, Paul. Yeah, I mean, essentially a similar story really to Rebecca. I've worked in road safety for 2.5 decades now. It seems that's a long time, isn't it? Anyway, my background is in road user behaviour. So I'm a psychologist by trade, but I try and make sure that understanding of human psychology is being applied to road safety in this case. And yeah, that's what I'm all about. So what I'd like to do today is really just talk about, you know, making this a bit more GB centric, if you like. And what I'm going to talk about is really trying to simplify the narrative as well. This is a sort of narrative that I'm trying to tell myself and refine over time. I think thinking about something Ian said about getting politicians more involved in this and more engaged, I think part of that is making the messaging really simple and repeating it. So that's what I'm going to do. So yeah, that's what I'm going to talk about. The title of my talk is Understanding GDL in Light of Alternatives, and also Skill Learning should be in there. I got to put that in the title. And I think my basic assertion, building on what Ian has talked about in terms of policy and on what Rebecca has talked about in terms of implementation in Australia, is that basically GDL is just a much more effective and obvious baseline situation for what our licensing system should look like if we think about what the alternatives are. And what the alternatives are is what we've got now, and maybe other ways of improving that. But if we consider how humans actually learn to drive, like they learn many skills, GDL makes a lot of sense. Luckily, Rebecca said a lot of the things that I would have said in terms of the evidence. So when I get to that part, I might be able to save us some time. So yeah, I'll talk about driver skill. I'll talk about risk factors for young and novice drivers. I'll talk about the evidence a little. And then I'd like to finish off by considering something that, again, the other speakers have touched on, but the kind of concerns and counter arguments that people tend to raise in discussions around GDL, and why, frankly, I don't think any of them are a problem. I'm not saying it's wrong to have those concerns, but when you actually scrutinize them, they all go away pretty much. And that's what we heard from the Australian experience. And then I'll just end by talking about where we are in the policy cycle around this in GB. So driver skill, I'm going to try and talk at a very high level on this because I don't think we need to go into lots of detail. The important thing for me, and I was really pleased, by the way, with your graph. I'm going to come back to the graph you showed, the before and after, because it aligns really well with this message. Basically, we know from about, I'm going to say, a century and a half's worth of research on skill learning, we know quite a lot about how humans learn skills. And there's a couple of sort of basic things we know, which is the first one is that people get better with practice. Okay, well, obviously, but there's something important in the nuance of that is that we see a very, very rapid improvement in skill learning in the early stages of practice. Okay, so you tend to see this very, very steep learning curve at the beginning, and then over time you get to a place where people are really just refining and tuning and building on that skill that they put into place. Now, typically when psychologists measure skills, they think about it in terms of either the amount of time it takes somebody to perform a task or how many errors people make. And both of those can be used as an index of how well people are doing. Now, what's really interesting is that when you look at the sort of data that we're talking about here, this is data from the 90s from the UK, you see this really, really steep learning curve at the beginning of people's driving career, crucially after they've started driving after having passed their test. This, to me, does not look like a licensing system that is equipping people with the things they need based on the stage of skill learning that they're at. And I've just put a quote here. I've got dozens of quotes like this from new drivers that I've spoken to over the years as part of various research projects. And this too, I think pretty much is it's the most common thing I hear unprompted from people when I ask people, what was it like when you started driving after you passed your test? And it is some form of, well, you know, that's when the learning to do real driving started, isn't it? This to me does not sound like the system we have is working well. There's something else about the system that is worth, again, just considering because it simplifies the message. And that is this. If the driving, this is not working. Oh, it is, okay. If we look at the pass rates for men and women, the average from 2007 to 2022, that's when I made this calculation, and that's as far back as the data go, we know that men across all age ranges pass the test at a greater rate than women. Okay, now there's various things that need to be looked into there, right? However, what's really interesting is that when you then look at the KSI casualties, you see the opposite. Well, you see the same effect, but you see the one that you wouldn't want to see if the driving test was letting the safest people through. Now, I am massively oversimplifying this, right? Because I've not accounted for exposure, but there's lots of research that does account for exposure that shows men are overrepresented in these kinds of collisions. And yeah, I'm also oversimplifying slightly in other ways, but the point is that this is not the pattern you would want to see. Okay, so that's where we are. What about the risk factors then? What do we know? Well, we've already heard from Rebecca. I don't need to go into lots of detail on this. Young drivers are overrepresented. Novice drivers are overrepresented. And we've long known that in the UK. Again, I'm showing data here from the UK, but there's data from all over the world showing this. And both of those things are important. Okay. There's also the higher risk situations that, again, Rebecca's covered, driving with passengers and driving at night. And in combination is even worse. So that brings us to the evidence part. What works? Okay, well, driver education and training is something that, you know, people fall back on. And I would say that this is the kind of paradigm we're in the UK. We train people, we educate people, and we do some testing. We've already seen the test isn't perfect. I'm not saying it's completely wrong, but it's not perfect. When we look at the education and training literature, we find something like this. I wrote this in 2010. I would still broadly stand by it. There have been some improvements. There have been some particular interventions which show promise, but broadly across the board, education and training doesn't do what did you call it, Ian? The positive bias, or the positive bias. The politicians, when they look at this problem, they're stuck in this intuitive mental model of what learning to drive is all about, whereas actually the data don't really agree with that model. We can also think about the unintended consequences of being within that paradigm, right? You get things like early licensure. We've seen that if people are younger when they're licensed, they're more risky. There's work from the States showing that if you allow people to fast track through the licensing system using ineffective things, some of which you mentioned, you've kind of had to put in place in Australia, I'm guessing because no system is ever perfect, you can get this effect where you're giving people effectively a benign kind of ineffective intervention that doesn't really do anything, but what it does do is it gets people through the licensing system earlier, and that makes them riskier. We've seen examples of training done wrong, the classic example being 1980s, 1990s skid pan training in some of the Scandinavian countries, where it made crashes worse for some groups. And I would argue really what we're here about to talk today is that if you have this paradigm where you're relying on training and education and testing, there's a lack of progress that comes from that, which is in adopting these more comprehensive approaches that work. These are the things that reduce collision risk. That's my sort of top 5. There's probably a few others that could be in a sort of best of the rest list, but essentially 4 of those things are things that are all associated with GDL. The one in brackets, their hazard perception testing, I would argue that that's the one area with this group in which we are world leading in the UK. What about then these concerns that people raise? Well, all I'm going to do here is I'm going to cite from a publication myself and others at TRL wrote a few years ago now, I think, for the RAC Foundation. It's linked there when these slides are sent out. And what that report responded to was the Transport Safety Committee report on young drivers that Ian referenced, the last one that was done, the one with the 14 school children who were asked about licensing. And what we did in that was we were careful to pick out each of those concerns that were raised by people as part of that consultation to understand where the evidence tells us this is actually going. And I'm just going to show you the table. I'm not going to talk through each of these in detail. I'll talk through maybe some of them in detail, but Rebecca's already mentioned, I think, you know, part of this work was talking to people like Rebecca. I don't know if we talked to you, I can't remember, but we talked to people like Rebecca from around the world who have experience of implementing a graduated system. And what they all told us was, yeah, people worry about things like access to employment, access to education. You know, there are small effects that need to be dealt with and so on, but none of this is the big, scary problem that people think it's going to be. And if every other country can do this, why can't we? There are some other examples here. I think the impact on rural areas is an interesting one, not least because the risks are higher in rural areas, so the benefits are greater as well. Some others from that report, I'm going to talk about 2 of these in particular. Enforcement, we've already talked about, that's a red herring. The lack of support from young people is interesting. The Transport Committee cited this Ipsos Mori survey from 2014 as showing that young people do not agree with graduated approaches. And in fact, the data from that survey show the opposite. There are more people who are supportive in that group than who are in opposition. So that's weird. And then the final one I want to talk about is the bottom one. This idea that GDL can't work here because we're Great Britain, we're not Australia, or we're not Canada, or we're not whatever. It's really interesting to me that every road safety strategy document from 1987 onwards starts with a statement along the lines of, Great Britain has some of the safest roads in the world. Now, that's an explicit comparison with other countries that we lean on heavily to show that we're doing well. But when we have lessons we can learn from other countries that are acting on risk factors that frankly are universal and that would work well here, we step back and say, no, we're too different. We can't benefit from this. That to me, I think seems, well, it's disingenuous at best. So where are we now in GB? This is where I'm definitely talking about stuff I know nothing about. I don't really understand how politics works. But what I can say is that I think, Ian, I agree with you. We're at a place we've never quite been before. And what's really interesting is we've had this advisory group. I won't name everybody on that group, but it includes many people who are probably on this call who have come together to understand what a GDL system might look like to start with in Great Britain. And we have broad agreement on that. And that's taking into account and balancing all of the pros and cons of the different system components. I'm not going to say anything about that today because it's still being written up. It's being refined in a report that's being written pretty much as we speak by the lead on the report is the RAC Foundation. And that will be published in due course. I can't say when, but that is going to be one of the mechanisms through which this next step is offered to the new government as a policy option, which I think is really exciting. That's me done. Thank you very much.
Fantastic. Thank you very much. I think we're going to widen the image out now and then lose the screen so you can see all four of us together. So I'm going to do a what's known as a shift so we can get across a bit more. First of all, just a comment, but basically I've been, before I was a professional, what we'll do is we'll share our microphone among the three of you if you sort of pass it around and things. But before I specialised in transport, I was a mainstream radio journalist. And I have to say, I've never come across policy being set by people it's going to affect so much as this before. It would be a bit like asking burglars if you want to crack down, if they think cracking down on burglary is a good idea or not. I mean, it just struck me as a very strange view to do. One question I want to ask about the fact that my two youngest children both have or had apps when they first passed their tests. So there were certain tests. They were testing how much they braked, how hard they accelerated, and there were limits on when they could drive overnight or anything like that. Have you seen any effect that's had on the effectiveness of safer driving among new drivers?
Telematics is a really promising avenue of research. But what's really interesting to me is that it's still unproven. And even the really promising data we have from some studies that have shown potential safety improvements, what we find is there's such variation in how those products, whether they're insurance products or training products, such variation in how they're implemented. Nobody's bothered to find out what the best way of implementing them is. So you've got all of these different types of telematics approaches. Some might be better than others. We don't really know. And often the driving force there is some kind of commercial business model rather than, oh, let's look at the evidence for who's safest and who isn't. So yeah, I would say not an alternative, maybe an adjacent thing to.
Yeah, and I'd agree. I mean, there certainly are some promising things. There's lots of research underway at the moment that's showing, emerging evidence about, how well it can work. But it's a supplement. It's a supplement to the other approaches. Again, there's an equity issue, whether people have access to them, how well they work. And I think we need to be really mindful around that telematics and distraction as well. Is actually we need to make sure that they're integrated properly so that they're actually then not be, if they're actually the sort of things that are installed in cars, that they're not then providing distraction to drivers and increasing the risk of crash as well. So there's a lot that we don't know, but I think we also need to be mindful, and it comes back to the question about driver training as well, which is that if you take a public health approach, legislation, enforcement and education is very effective. GDL, if you're looking at cost-effective approaches that are going to be effective, it's actually GDL, and then all the things like telematics are going to be supplements and complementary to that.
And you mentioned that you worked in the NHS. Tell me, why aren't we concentrating on road safety as a health issue? Why is it a transport issue? Why isn't the Department for Health banging the drum to say that we should be doing more about overall road safety, and specifically road safety among younger people, where it's such a major cause of death among that part of the population?
Really good question. I'd probably say two things. One, from a historical point of view, if you look at the 1987 and the 2000 policy documents in the UK that were groundbreaking, they were very significant and they had very significant impact. One of the things that was a very strong flavour in both of them was there was cross-government centrally, but also importantly within the devolved nations. It's obviously different lines were drawn back then. That was really quite important, and the health voice was very much there. It was very much in terms of these are the consequences on the health system, whether that's mental health or physical health. I think we often forget the mental health part of this, but also the public health voice was very, very visible there. Fast forward, those documents that came later were very much generated from the Department for Transport, and I think we lost something very, very significant. So I think it's one of the things I point to as one of the big problems. I mentioned it in my little talk, that the public health and the health voice is not as vocal as it needs to be. The letter I mentioned in The Guardian had some eminent health clinicians signing up to that approach, but that is actually quite rare. The other thing I would say from a completely different perspective is that the impact on the people who work within the health system, but also the emergency system, whether they are police, fire, etc., is very, very significant. I always kind of share this little story. I met a consultant who does retrieval at the roadside, who is supportive of graduated driving licensing, and for all the reasons that we've talked about this morning, but also from the point of view of those poor souls who have to pitch up at the roadside and do what they have to do, which I won't use any words to describe. That is enormous, regardless of how many beds are used within the health system, how many people are waiting for mental health support, how many people who need wheelchair services, etc. The list is quite endless. And then the cost, 43 billion across the whole economy within the UK, according to DFT stats. But I think the point I wanted to make was the impact on those people, those clinicians, those nurses, those doctors, those police, etc., is very, very significant. And the voice is not there because a lot of those services are on their knees. So if I look at the health service and my colleagues who I still know, they're in siege mentality. They're sorting out the major problems and haven't got the bandwidth, they haven't got the capacity, even if there's the will to actually do something about it.
Got a question that's come in. By the way, if you want to add questions, bottom of the Zoom screen that you're looking at, you can click on a Q&A section and fill a question in, and we'll come to our experts sitting here at SMLL in a moment. But one question that came in for you, Rebecca, is that are there any thoughts on to ensure success without supportive parents? I mean, there must be parents that if you have to sign the logbook, will just fudge it. Or also, what happens to younger people whose parents don't drive, for example?
Look, I think, I mean, the logbooks are really important, and you know, there will always be people who will fudge it. But one of the when you look at the structure of the graduated driver licensing system, you have to have your learner license for a minimum of 12 months. And so, you know, that on its own actually ensures that young people are getting some certain level of experience. You know, if they're a little bit older when they get their license, and you can set it up. I mean, you can't completely get away from that because it's very hard to actually verify it. But I mean, some of the apps actually also do, I think, record the driving in the car as well. So you can actually have GPS-based apps. For parents, young people who don't have a parent with a license or a car, that's where those licensing support programs come in, and they are important because, again, there's an equity issue. It's just making sure that there are programs in place. So the ones in Australia that we have, you know, sometimes they have access to driving instructors, but others, they have access to a car and to volunteers. So you can actually sign up as a volunteer and help other young people from, you know, marginalised backgrounds who don't have access to actually get their driver's license. So those kind of programs are also in place.
Sit through really rather well. Well done. So another question that's come in from Professor Sally Kidd of the University of Leicester has asked, has it had a wider culture change among the way that people drive, and especially with parents thinking again about how people drive and drive safely? Has it had wider benefits beyond just the cohort that you're looking at?
Look, I don't know that I've got research to show that, but I do think there has been a culture change. I mean, as we talked about before, the discussion about giving parents a license to actually then put restrictions on their young teenager that they otherwise wouldn't have. But again, it gives people at a community level, I think perceptions of safety for young drivers has changed. So in fact, people are probably a bit more tolerant about young drivers on the road. And more aware of that because of all the education campaigns. And most people have at some point got a young person in their lives who they know are going through that system. So I think people are more aware. I do think there has been a big culture change. And I think one of the other things is worth looking at, and this has come out of the US, we've seen a little bit of in Australia, is the concept of parent-teen agreements as well, which is actually, you know, again, it's not an alternative, it's a supplement to graduated driver licensing, which is where you sit down with your young person and say, all right, well, yep, you can drive the car, but you need to bring it back by this time. And if you do that, well, you can use it next week. But if you don't bring it back, you know, we're going to limit your access. So there are, you know, lots of other things that you can do. But I really do think the culture has changed dramatically, and it's changed in a way that also hasn't put restrictions on young drivers. So young people, you know, overall, when we talk about access to education and employment, young people's access to education and employment hasn't changed. If they need a car to get there, they can still use a car to get there from the age of 17.
Things that concern me about my youngest son recently, when he passed his test before he was 18, was that for the whole of the summer he's been playing cricket with older teammates who've all loved the fact that he's passed his test because he can drive, because he can't drink, so they can all then have a drink. So there's almost that expectation on him to suddenly become the designated driver with young teammates the moment he's passed his test.
Yeah, I mean, I think that's interesting. I don't know that I'd like the thought of a young driver in a car with a whole lot of slightly inebriated older people. But so yeah, the passenger restriction will help with that, I think, at night. But it does start getting people thinking about it. So I do think people then start saying, actually, driving with passengers is not safe for a young driver. So let's not do that. You encourage that broader discussion about that. Certainly, I think it's another, you know, we've seen parents, you know, liking the fact that their young driver has got a car, so they then become the driver rather than the parent as well for the same reason.
Let's go to the audience. Jamie Hassel from, you have a question for us?
Yeah, so my daughter's just passed her test, and as part of that, they're taught to drive up to the speed limit. So I think she drives too fast on single carriageway roads. So I was really interested to see on one of your slides that for sort of novice drivers, they have a restricted speed limit. You know, I would love that instructors in this country were sort of saying, okay, the speed limit's 60, but no way should you be going anywhere near that. Yeah, I think actually they have to, because in the test, if they think it's failed to make progress, I think that's still a thing, sort of thing. So I was really interested about those sort of lower limits and how, you know, how can we get things like that changed now before we get the sort of full GDL in place?
Yeah, the speed one's an interesting one. I guess that's probably one of the more controversial elements of the GLS. But actually, when we talk about culture, you see often on the highway, so you might have highways in Australia where the speed limit's 110 kilometres an hour, and you have people on their red Ps driving at 90, and there's a big speed differential, and then, you know, faster for people on their green Ps. But again, I think it's actually changed community as well, because people recognise you've got these big red and green plates. You see, oh, there's traffic banked up there. What is it? It's a P plate driver, and I think people are tolerant of that. There is always debate about those things, but certainly I think for drivers, we all know how far. I mean, I actually. I think speed is implicated in 70% of fatalities. Speed is a major issue in Australia. And I think actually that's an important message to say, actually recognising it is, and young drivers shouldn't be going that fast until they've got a bit more experience.
Give the opposite, though, that we, dutiful, good, road safety conscious parents, put green P plates that are voluntary on our children's cars, and especially my daughter. The moment they see young girl P plate in a, forgive me for saying, crappy old car that she was in, people drove like absolute idiots around her to, oh no, there's a new driver going to get in the way. They'd cut her up, they'd push in front at traffic. She had a much better time of it when we took those plates off.
Yeah, well, I mean, I think look, there's always going to be discussion about those kind of things, but I think we just have to stick with it to say we like to flag that it's a new driver. You need to be careful around it. I think there's a lot of education and community engagement we need to do with the rest of the community about road safety as well. And I think we're seeing that now. We've seen, and I think UK is the same as Australia. In the US, we're seeing an uptick in road crashes at the moment post-COVID. We're not sure why that is. People are driving more recklessly. I think it's something about individual culture and people feeling like, you know, they can do whatever they like. And especially now in Australia, we're seeing these horrifyingly large SUVs coming in as well, which people are sort of weaponizing on the roads as well. Terrible. I think we do need to keep coming back to that. And I think the discussion around that's not about graduated driver licensing and whether we should be doing that. It's actually about we should be regulating speed better. We should be, and actually we should be penalising those drivers that behave in a bad way like that as much as we can, because that is unacceptable behaviour.
Can I just comment on that as well from the sort of wider cultural perspective here? Because I'm beginning to think that GDL is just one of a set of policies that represent a culture shift in the way we think about road safety. And what I mean by that is, so I am still horrified to hear, and I won't name names, but I'm still horrified to hear on the conference circuit in road safety, I have heard people who work for road safety related companies or organizations joke about speeding, right? Joke about how they, I don't know, had to get there on time today to set up their stand and they had to break the speed limit to do so. That's completely unacceptable. And that kind of behavior and culture across, you say the community, across the public, needs to be called out more and more. And when you have a policy instrument like graduated licensing, what that does is it empowers people to call out some of the things that contribute to that culture. That's my belief anyway. I don't have any evidence on that, but it feels very much to me like if you get people thinking differently and more seriously about what road safety outcomes actually are when they go wrong, you get that change in culture over time that we need. So in one sense, GDL is just one piece of that puzzle.
I mean, yeah, we could go on for hours on so many different tangents because, for example, you touch on the speeding and the frustration. I was chatting to Jo Shiner, who we talked about, head of roads policing in the UK, and she was very frustrated that you only get your speed awareness course once you've been caught speeding, which seems a really strange way of doing it. And anyone that's been on a speed awareness course, whether they want to admit it or not, do drive differently after they've seen this evidence for a couple of hours in front of them. There's been a message on the Q&A, Ian, about the fact that one of the contributors has been frustrated about the fact that they've tried to get trauma surgeons in to talk to politicians about the effect of road crashes, and they don't, and they won't come. They'll send a junior along who doesn't have the same experience, so the gravitas isn't there. Just the use of the word accident instead of crash is a massive frustration as well to me.
Experience from Australia has been, we have trauma committees with the Royal Australasian College of Surgeons, and that's been tremendously important over the last, over decades in road safety and injury in general. So they've actually got, they take up advocacy as being something that's really important. At the moment, we have John Crozier has been a really great ally. We have, and they're there at the front foot. And I completely concur. I think that's where we really do need to ask clinicians to step up and support it, support, change.
I think I'd probably add two things. One of which is I have a huge amount of sympathy with the people you're talking about who are just out there busy constantly. And that's not an excuse. I'm not excusing the lack of engagement. But I think we just have to have a little bit of kind of humility in terms of just the challenges within the health system, across the health system. So if you are taking a trauma surgeon for half a day away to a committee, you have not got that trauma surgeon in A&E or in the trauma centre. So I'm kind of stating the obvious to an extent, but I think we just need a little bit of humility about that. I think the more important point I wanted to make is this, I think, is where we can make some of the biggest strides in the UK. I think it's one of our biggest weaknesses. If I reflect on where we've come from in the last year or so, quite a lot of the things that Rebecca has shared with us today, we're on a journey and they're improving and we are getting better at them. The weakness is within public health and the health system. So I think one of my personal campaigning tasks going forward is actually how can we better engage. There's some ideas being kicked around actually describing the stories of victims of road crashes in a, I don't know whether this will actually fly because we're going to try and seek some funding, but can we find 5 people who are willing to talk to us in terms of, here's the case study, this is the reason I have a wheelchair, this is a reason that I've lost 5 inches in my height because of my trauma, etc. I mean, I'm not kind of predicting what the case studies might look like, but things like that I hope will start to help. And as we engage more with some of the professional associations, the Royal College of Surgeons for Edinburgh, for example, were one of the, Pamela Hardy, I think is her name, Dr. Pamela Hardy, who was one of the people who signed the Guardian letter, for example. There are a lot of people out there. Tim Nutbean is a professor in Plymouth. There are a lot of people out there, I probably shouldn't be naming them, but sorry if you get inundated. There are a lot of people out there who are genuinely interested, that do really want to not go to that roadside, not want to go to A&E, not go to the air ambulance to get people out. But I think we just, to circle back, I think we just need to have a little bit of patience with them. And that's why I think we need to target other routes and some of the professional associations more effectively.
We're just about out of time, but I just want to say, so just notes going through. Lillian Greenwood came up. She is now a transport minister. She has spoken in the Commons about her support for this. Jo Shiner, head of roads policing in the UK, big supporter. When I interviewed her for my podcast a couple of months ago, one of the things that she really wanted to talk about was a graduated driving license. You've got the Guardian letter. You've got, I'd be really interested if we could see some research, not talking to teenagers about whether they think it's a good idea, but talking to parents about whether they think it's a good idea, because I know 100% of people who are parents in my house would very much back this. How are we going to go from sitting here in a room where I think if we had a show of hands, everyone would think it's a good idea, to actually getting it implemented? I'd like to hear from all 3 of you to sum up.
Given I've got this, I'll go first. So I think we've got a huge opportunity. I sense, and I might be being deluded rather than optimistic, but I do sense a more receptive ear in government. We already know that there is a road safety strategy being written. We don't know detail and timescales, but we know that the commitment is there. That is a significant step forward given where we've come from in the last 15 years, possibly even 20 years. So I think that's really very significant. We've had a significant amount of support within the Road Safety Manifesto, which has got GDL included in it. So we have got about 100 organisations within this space who are supporting it. We've got Forget Me Not Families Uniting, who are planning a campaign to start this. Now Parliament started, and I'm not going to share exactly where that will take us, but part of that is visibility. So one of the things for me is we need to be much more visible. We are very good at talking to the tribe. We are very good at talking to the audience today. I suspect there's very few dissenters, and we've not heard from them if there are. I suspect that we're very good at doing that. I think we need to talk to people who are not dissenters. My Twitter feed is always very interesting. There's some right comments that come through the other way, and a lot of it's about just keep going with it, educating. People like the Daily Telegraph don't help when they publish headlines that talk about perverse freedom restrictions. So there's something really very important about language. I mentioned that in my presentation. Language is really very important. If we're talking about accidental and daft young lads all the time, rather than the 8-year-old child who was knocked over on her way to ballet and killed, and we talk about prevention, that these are largely preventable, as we've heard from Rebecca and Shaun in terms of the data. So I think there's a lot more that we can do. You mentioned Lillian Greenwood by name. She's no relation, by the way, or not that I know of anyway. I do sense a different approach. I guess my view would be it depends on the higher up in government, the higher ups in government. We know from public record that Lillian does support this. Whether the higher ups within government will allow something like this when the other side of government is looking at supporting young people. Louise Hayes talking about driving tests, for example. They want to give young people the vote at 16. So that there's a big part of the story. And I think one of the biggest things I've heard from Rebecca, which I think we need to do differently in the UK, is we need to focus on, we are not restricting the young driver. We are enabling them to be supported, to have more experience. you can still carry on doing your day-to-day life. We've not really got that message across very strongly. It's always gone down the negative route of restrictions.
Thank you. And I think part of and you know, everything's being mobilised now, and I can see there's a lot of support in the UK for this. I think a couple of points. One is that behaviour change in the community around road safety is really most effectively changed by the legislation, enforcement, and education. We know that. And I think what's really important is that we don't keep gravitating back to, oh yes, but we can do driver training. Oh yes, but we can use telematics. That will fix it. It won't fix that. If you want population level change, you need legislation and enforcement. This is going to work. We have a really effective, we have a really effective approach in graduated driver licensing, which has been implemented in multiple settings. It's highly effective, it's cost effective, and it saves lives. It stops young people from being killed and seriously injured. As I showed you, 50% reduction in multi-passenger crashes at night is unbelievable. We don't see that kind of level of, effect in very many other interventions. So that's really important. I think just staying strong to that, making a message that's really clear. It does need community support, community panels, community engagement, bringing the media along, having champions in the media, in government, and victims groups and advocacy is really important. I mean, the evidence is there in the background. It's actually just about political will and actually having a strong government that's actually willing to put their money where their mouth is and say, well, we actually do want to save young people's lives. We've got this here. We can put it in place. And you'll find as soon as it's put in place, 5 or 10 years later, it will be such a non-issue and you will have saved so many young people's lives. It obviously is going to be worthwhile.
I kind of want to stay silent because I kind of want that statement you just made to be the last thing on the transcript. I can't really add much to that other than to say everybody in this room and everybody on this call should be repeating this message, I think, in whatever way you can. I intend to keep trotting out the same message whenever I'm asked to talk about this and just point out that this is clearly a more sensible way to go. That is all I can do, I think.
That's Dr. Shaun Helman from TRL. He's also been joined by Dr. Ian Greenwood, a road safety campaigner, and Professor Rebecca Ivers, who's over in London from the University of New South Wales in Sydney. And what a powerful discussion that we've had for the last hour and a half. When we do these, we always set them for an hour. We thought this was such an important subject, we needed to add an extra 20 minutes to it. We've actually still overrun. We've done more than an hour and a half. So thank you for sticking with us through this fantastic discussion. We can continue on LinkedIn and other things that TRL are doing, and we will have another webinar from TRL very soon. But thank you very much for watching. If we haven't got to your questions, I apologize, but you can give an applause at home or in the office, which we won't hear, but our audience here can now applaud. And thank you very much for your time, and we'll join you again soon. Thank you.